Please, can you tell us where you're joining us from? What part of the world or what state? It's always interesting to see different people join us from different parts of the world. That's the whole purpose of Lab to Doctors. We are a global platform, so we are always excited to see people joining from different parts of the world.
Hi, Leonard. Okay, joining from Abuja, Nigeria. Welcome. Oh, okay, and you just got in from Cameroon. Nice. Hi, Vincent, joining from Lagos, Nigeria. You're welcome. Okay, so I think at this point we would get started while others joining um later. I'm sure we're gonna have more people joining. So we're just going to get started so we can ensure that we finish on time. And welcome again, everyone. Welcome to today's webinar. Good morning, good afternoon from wherever you're joining us from. And my name is Bukola Kolade, and I'll be your host for today. Whether you're joining us from a clinic, from a lab, from a ward, from your home office, or you're just at home, you're welcome. And we are really glad to have you here today for today's conversation. And before we dive in, I would just want to take a moment to appreciate this wonderful community. Every month we have these webinars where we have healthcare professionals from different disciplines across the world show up for these sessions, curious, engaged, and committed to learning. And that means a whole lot to us at Lab to Doctors. And we really appreciate that. Thank you so much for being here. Uh, Now, going on to today's topic, I know some of us already know what today's topic is about or have an idea of what today's topic is. And I think that a lot of us will find the topic instantly familiar because if you spend time, any time at all in clinical practice, maybe you've done some learning, anything, or you even work in clinical practice, you've likely had that moment where a lab result comes back and something just doesn't seem right about that result. Maybe the numbers are not quite right or they don't match the patient that is in front of you, and in that moment you're thinking, what do you do? So that's exactly what we're going to be exploring today. It's all about diagnostics discordance. Sometimes it's a pre-analytical issue, sometimes it's biological variation, sometimes it's medication, sometimes it's the way the sample was handled, or even the way the disease presents itself, right? And if it's not approached carefully, these situations can lead to misdiagnosis, repeat visits. So today's conversation is very important, and I would want us to really pay attention, be engaged, because this session is not just about lab results. It's about clinical judgment. It's about learning to pause, ask the right questions, and just look beyond the report to seeing the full picture, the full patient context. All right. And to guide us through today's conversation, I'm sure some of us already heard us speak early on, is Dr. Chesi Voma, and she's a clinical chemist, medical laboratory director, and founder of Lab to Doctors. Dr. Chelsea brings a wealth of real world clinical and laboratory experience and expertise to everything she does. And today's session is no exception. I'm sure you're going to enjoy the session, and I encourage you to stay engaged because it's going to be very interactive, right? So there's going to be a lot of interaction. There are going to be questions. We'd like you to drop your answers in the chat. So I would encourage us to really stay engaged, be interactive, reflect on your own experiences, bring your questions as well, because there's going to be a Q&A session at the end of this at the end of Dr. Chess's presentation. So I would want us to also feel free to ask questions. All right. Welcome again, everyone. You're welcome to today's session. Dr. Chelsea, the floor is yours. Welcome.
Thank you, Bukola, and thanks for the kind introduction and welcome to our webinar session today. I hope that you've come ready not just to listen, but use your personal experiences in healthcare, either as a patient, as a clinician, as a nurse, or a caregiver, to participate in the interactive session and let us know at the end what you benefited from it. So I'm going to share my slides at this time. Okay, I'm going to minimize this so I can see everything I need to see. So once again, the title of our presentation today, the webinar presentation today is When Lab Results Don't Match the Patient. I want us to understand diagnostic discordance that happens in real life. When there's a sick person and a normal lab result, what do we do with it? What causes it? And how can we avoid it? That's what we are here to learn today. Before we begin, this is the first interactive session question I have for everyone to drop in the chat window. I want you to type one word describing how you feel when labs don't match symptoms, whether it's your symptoms or your parents' symptoms or your baby's symptoms. When you had those lab results and it did not match the symptom, how did you feel like? Please, can you drop your responses in the chat window? Let me see how it affects people differently. Any of these responses that are provided will be okay. A, confused. B, frustrated. C, anxious. D, curious. E, overwhelmed. Where do you fall when you are so sick and you got lab results that says that no, she's well, or your dad was so sick and the lab results said no, he's not that sick? How do you feel? How does it make you feel? Can you drop your, thanks, Halima. Can you drop your responses in the chat window? Thanks for those who have responded. Somebody says overwhelmed, somebody says confused. Can the others drop their responses? I think we are, okay, there's another confused. Yes, I'm waiting on the others. How do you feel? Can you just actually participate if you want to get something out of this? That's a good way of learning. D, somebody says curious. Okay. Anybody else? Any more responses to tell us how you feel when you're so sick and the lab says that he's fine? Somebody's almost dying and the lab gives different results, or somebody's not even sick, but the lab says that this person is dying. Okay, so at this point in time, I've seen your responses. They are all very valid. I'm going to share with you what typically people would feel. Typically, everybody feels one of these five, has one of these five feelings. Confused. What do I do with this? Frustrated. Is this real? Anxious. Oh my goodness, am I dying? Curious. Is this for real? Overwhelmed. We just don't know what to do with the results when you have a very sick patient and the lab results do not really tell you the same story. So there's definitely a diagnostic disconnect. Labs mostly drive clinical decisions. That's why clinicians, nurses, people in the healthcare profession, that's why they typically order lab tests to be able to manage a disease, diagnose or treat a patient. Yet the symptoms do not always align with the lab results. And it's this misalignment that I call discordant lab results. Discordance creates anxiety, mistrust, and repeat visits. So mistrust in the sense that you may even start doubting if your doctor knows what he or she is doing, not knowing that it's because of something that happened to the sample. You may just develop some kind of anxiety, like, oh my goodness, they said I have cancer. And when it turns out that the sample wasn't collected at the right time, thereby giving false positive results. And the doctor is going to tell you what? Come in again for another blood draw. You don't even have the time. You don't have the money to go to the doctor's office. Yet they are calling you again for another blood draw. What happened with the first one? What are they going to do differently this time that would avoid it? Those are all the questions that sometimes goes through our heads. Especially for some of us, there are people who have to go to the hospital. They are the patients and they are out there at the hospital. And you have to go over and over to have the sample collected. When are you going to be treated? So there are different reasons why lab results don't always match the symptoms. We are going to look at some of those reasons here. The first of these reasons is biological variation. So when we talk about biological variation, an example is with, I'm just going to give examples because we cannot talk about every lab test in 45 minutes. So for example, uric acid. Uric acid is typically ordered when when the clinician wants to evaluate a patient who has gout, like you complain that your knees are hurting, you cannot bend them. They just, you just give some kind of gouty complaint that the doctor needs to know what is wrong. They would order for uric acid. Uric acid is also ordered when they want to assess the presence of kidney stones. So, and it's also ordered for kidney function. And sometimes it's also ordered to monitor patients who are on chemotherapy. So, but guess what? This very uric acid can be, the results can be altered because of the presence of purine in animal products and certain seafoods. So let's say you're one of those who loves eating seafood. You just got through eating some shrimps, this big bowl of shrimps or some shrimp fried rice, and you went out there to have your sample test collected for uric acid testing. Just know you've compromised those results. It may end up being terribly high just because of the seafood. It may make somebody feel that you are very sick when you are not that sick. It may make somebody feel that the medication I prescribed last week is not working because the uric acid level has not gone down. Meanwhile, it's just the seafood that you had. The next item is the pre-analytical factors. So samples are collected at specific times of the day. Sometimes the doctor could say, give us a fasting sample. We want this sample collected in the evening, or we want it collected in the morning. And there's a particular order of draw. If you do not respect these specific instructions, the doctor says you give it in the morning, collect the sample in the morning, and you decide to go in the afternoon after work or after visiting your friends, say, okay, I'm going to stop at the lab. You are jeopardizing your care and you are preventing accurate diagnosis of your situation by not following strict orders from your clinician. The lab would not know if you actually fasted. The lab would not know the time that the doctor wanted you to come and get the blood drawn. But whenever you give us samples, we are going to test it. It's left on you to ensure that you follow the instructions of your clinician. The third reason why the lab results don't always match is analytical differences between labs. So you could be, let's say there's lab A that is right next to your house, and your doctor wants you to do a B12 test or a vitamin D test. You go out there, and B12 and vitamin D are normally tests that are either performed with, that are mostly performed with immunoassays. Because immunoassay is a cheap test, other labs that can afford the mass spec tend to do vitamin D on mass spec. But for the most part, most labs do B12 and vitamin D with immunoassays. But now there's a problem with immunoassays. It's not that immunoassays are bad. What happens with immunoassays is that there's a lot of variability when it comes to, so one manufacturer could use a different target. Remember, immunoassays are targeting antibodies that they use in identifying the analyte that is being tested. But if you go to have the test done, and the first time you test in lab A, which is next to your house, and the next time your doctor wants you to do this test, and you're visiting a friend, your friend's house is next to lab B, and that's where you do it. Your doctor cannot compare these methods, compare the results, because it's possible that the two labs are not using the same method. So when you find yourself in this situation, if your clinician actually doesn't know the methods, your best bet would be to reach out to a platform like Lab to Doctors, or reach out to any medical lab director that you know, to be able to help you figure out why these results are inconsistent, why they are discordant between labs, because different labs have different methods. There's also the interpretation challenges. So an example with the interpretation challenge is ferritin. Ferritin is a protein in the body that is used in binding iron. So when you are iron deficient, your ferritin levels would be depleted. But guess what? When you have inflammation, ferritin is also known as an acute phase reactant. So if let's say you have iron deficiency anemia, but you're also inflamed. So these are arrows pointing towards two directions. With iron deficiency anemia, ferritin is going to go down. But then with inflammation, ferritin would go up. So it's possible that inflammation is going to mask your ferritin results, and the clinician would, or your nurse will not be able to interpret it correctly. They're going to say that, oh no, your ferritin is normal, so you don't have iron deficiency. Meanwhile, you're actually experiencing a lot of inflammation that has caused your ferritin levels to go up. In this case, you need to look for another test. Identify another test that is not compromised by inflammation, to be able to actually rule out if this was due to inflammation or if you are actually dealing with iron deficiency. So these are some of the reasons why we have discordance. What patients should know, what we expect patients to know. Normal doesn't always mean fine. If you do your glucose test and it comes within the normal range, you'll be like, yay, my glucose is fine. I'm not diabetic, and you're so happy about it. But what I want you to know today is that one glucose result is a snapshot of that instant when you were tested. That glucose result is not a representation of your entire day. It's a snapshot of that period when that blood was collected. So it's possible. Glucose, when it comes to diabetes, glucose is the last thing to indicate that you are diabetic. Because by the time you start seeing that glucose elevated and out of the normal range, it means that your insulin resistance had been long existing. There's insulin, your body compensates for the elevated glucose by releasing more insulin. But when the compensation can no longer happen, then you see the glucose elevated. So do not look at one result as do not use one result to be able to diagnose or treat yourself accurately. It's usually preferred when you look at a trend of results. Look at the results that you've been collecting for the past months or the past weeks to be able to see how your glucose levels, for example, are trending. The next thing we want patients to know is abnormal doesn't always mean danger. So the fact that your results are out of the normal range doesn't mean that you are in danger. It doesn't mean that you're dying. The example for this I'm going to give you is platelets. So platelets, which are one of the cells, the cells that we have in blood, platelets tend to increase when you do intense exercise. Let's say you go out to jog, or you play soccer, or you run a lot, or just anything that is really intense. When you are involved in intense exercise, or platelet levels will increase. Also, when you're dealing with inflammation, your platelet levels will increase. But this doesn't mean that is anything wrong. It is transient, it's temporary. It's increasing in response to what your body is experiencing. When you stop that exercise, shortly after that, the platelet levels will get to normal. When you're no longer inflamed or whatever is causing that inflammation, the platelet levels will get to normal. So this level of increase, this abnormal is not pathological. It's physiological because it's responding to what your body is going through. So do not always act on a result because you don't have to always take medicine because the result is out of the normal range. There's more that clinicians look into than just this lab results. When they see it like that, there are other things that they have to be looking at. The next thing that we want patients to know is that the trend of your result matters more than the single value. Just like what I told you about glucose. It's the same thing with hemoglobin A1C. Hemoglobin A1C is used in diagnosing and managing diabetes. And one A1C result or one glucose result should not be the reason why you are diagnosed with diabetes. You would want to see a trend. Sometimes they even do the test 3 times. Sometimes maybe for financial reasons, the test will be done twice. But whatever the case, do not rely on one value to call the shots, to diagnose yourself when you're not quite sure. We also want patients to know that your symptoms are valid. If for any reason your lab result says that it's normal. It shows it's normal. But then you really feel sick. It's your body. You are feeling it. Your baby feels sick. You're seeing your baby looking different from what they were before. Trust your symptoms. Those symptoms are valid. You don't treat the numbers. You treat the patient. When this happens, in as much as we have reference ranges in the lab, reference ranges are a powerful tool that is used in diagnosing, in treating, in identifying somebody, differentiating somebody who is sick from someone who is not sick. But also, reference ranges are not the final authority in a patient's health. With real symptoms, while the labs fail to indicate that the patient is sick, it is very important that you make sure that your clinician or your nurse, whoever you're seeing, understands that I really feel sick. These results do not reflect me. Because when reference ranges are made, sometimes, depending on the analyte, they did not do the reference range while the patient was resting, or while the patient was not inflamed, or while the patient was not exercising. We collect these numbers from individuals who are, in quote, normal, who are healthy, and we call it the normal range. We did not go in to say that this person should be resting, they shouldn't be inflamed. We did not even check if they were inflamed or not. So there are a lot of other variables, and that's the reason why do not stick to the number. Treat the patient and not the lab results. There are three things that labs want you to know. Variation is normal. It's normal for your labs to vary from time to time. It's very normal. Depending on the labs that you are out there to do, like I mentioned earlier, different labs are collected at different times. So, for example, cortisol increases a lot. It's at its peak early in the morning, and it's the lowest in the evening. So it's important that, again, you be aware of the time that you're providing your sample. If you see variations, you want to ask that, is this one of the analytes that fluctuates? Is this one of the analytes that would increase by the day? Hydration. If you drank a lot of water before going out to provide your sample to the lab, you know that you may have diluted some of the analytes. You may have diluted your electrolytes. You may have diluted your total proteins. So you have to be mindful of everything you do before you go out to give your sample, so that when those results come and they don't look like you, and you may have even forgotten what you did before you went for the blood draw. That's why on the Lab to Doctors platform, if you ever have these questions, when you come to the platform for us to help you figure out why your results are inconsistent, we are going to ask you these same questions. What did you do before the sample was drawn? When was the sample drawn? Did you go to exercise? What season was it done? Sometimes in the spring, like here in the US, some people suffer from seasonal allergies. When you suffer from seasonal allergies, it tends to increase your eosinophils. This is just seasonal allergies. It doesn't mean anything is wrong with you. You just have to be aware that during the season, my eosinophils will be increased because of seasonal allergies. The other thing we want you guys to know is that the method differences matter. I just told you about A1C and glucose. So for A1C, for example, has like 6 different methods. There are 6 different manufacturers. Some of us here actually take turmeric for one reason or the other. But I'm sure none of you knows that turmeric affects the A1C results in one of these 5 methods. Because the wavelength that is used in measuring A1C is the same wavelength that would measure turmeric. So if you've taken a lot of turmeric and turmeric is like some yellowish orange kind of color. If you have it a lot that is actually in your system, it is going to mask the A1C. Your A1C may be low, but it's going to show your A1C falsely elevated because you took turmeric and you took it a lot. It's not just any amount of turmeric. When you exaggerate, some people want to take it and put it in rice, put it in tea, put it in their water. So just be aware that whatever you do in advance of your sample collection, it could tend to affect your results because of the method that is used in the lab that you selected. We also want you to know that the quality checks, that there are some quality checks that you should do to protect yourself. So what are some of these quality checks? Let me take this up here so I can read it properly. So these quality checks include, you need to check, does the result fit? When you get those results, you need to check yourself. Does this fit my symptoms? Is this the way I feel? You need to compare your results with the prior results. Let's say you did it 1 month ago, or 3 months ago. What was it like back then? Was I sick then? And am I still sick now? Am I feeling the same? You need to confirm that the correct sample was collected. You need to check for methods and analyzer differences, like I told you about A1C and turmeric. And it's only one of the 5 methods that turmeric would affect because of the wavelength that that method measures compared to turmeric. Also, the reference ranges, you need to check the reference ranges. Delta checks basically means that you're comparing your previous result to the current one. Critical values, did you have any critical values? Values that were out of the normal, that needed medical attention, did you have any? Biological variation, again, it simply means, the time, your system, whether you are a female and what is going on within your body. There are some things that happen within your body. We call them endogenous changes. And these are changes that happen within you and would also tend to affect your results. There are other interferences that are present. Again, when I talk about interferences, it's just like turmeric that I made mention of. So turmeric would interfere with the results of your A1C. If you had low A1C, because of turmeric, if you go to a lab that uses a method that deals with this interference, you would have falsely elevated A1C because of turmeric. That doesn't reflect you. It's reflecting your sample. Who feels the frustration? So this is another, I need you guys to drop your responses in the chat window. So who feels the frustration when all of this happens? Is it the clinician? Who feels the most frustration? Do you think it's the doctor, the nurses, the patients, caregivers, or the lab? Please drop your responses in the chat window. Let's see who you think suffers most from this. Who feels the most frustration? Is it your doctor, the nurses, the patients, caregivers, or the lab? Or somebody says the patients. I can feel you. The patients, oh my goodness, this is really sad. And I think this is right. So does anybody else have something to say? Everybody is saying patients, patients. Okay, I see that at this point, I'm going to give you the answers of who feels the most frustration when this happens. So let's see here. Everybody feels the most frustration. I understand that when we say the patients is because I think if I were in your shoes, I would also say the patients, right? But I also want to assure you that even the lab feels the frustration. Because again, can you imagine this issue with turmeric and hemoglobin A1C? When we receive the requisition in the lab to test your A1C, it's not written on it that you took turmeric. So how do they expect us to know? So there's information that is with the doctor that doesn't come to the lab. And we do our due diligence to test this sample to ensure that we've removed every interference, every possible interference. But then we are not magicians to know what the patient is taking. This is the point where I tell patients that you need to communicate your clinician everything you're taking. Because even the clinicians who are not pathologists like myself will not be able to know what I'm telling you. Your family medicine doctor, your internal medicine doctor, they are so good at what they do. They are going to do their job to diagnose and treat you based on those lab results. It is your place because they are not magicians. They don't know what you do what you did before going to provide your lab sample. So we're proceeding. There are some common patterns of discordance. Sometimes you have normal labs yet you have symptoms. My labs are normal, yet I'm feeling so sick. Why is this happening? Or my labs are abnormal and I have no symptoms. So these are some of the trends that we see or the patterns that we see when there's discordance and that the clinician would take note of. And sometimes the results are just conflicting. Last week it was low, this week is high, the next week it says normal. When you start seeing all these trends, it's time to stop and say, I'm going to look for a lab expert, the people on Lab to Doctors, or the medical lab directors who are on that platform. This is just what they do. If you go to Lab to Doctors, you'll be able to find someone who would answer these questions for you. I always tell people not to really rely on. I know that the world is shifting towards AI, but I would tell you that myself, I've gone to AI and actually seen some wrong results. So you want to be very careful with your resources. That's why I prefer that you look for a medical lab professional to answer your questions when you see these patterns of discordance. Sometimes even you find a doctor telling you to do a repeat test. Like, why are they sending me to repeat this test? I the last time I spent $500 to get to the doctor's office, I'm going to do it again. What went wrong? What happened to my sample? When you start seeing this is discordance. It's high time you guys look for the professionals because you will not be able to know what we know being in the lab. This is what we do. We design this test, we validate them, we ensure the quality control, we interpret the results, we know the interferences, so we are just better placed to be able to tell you faster, quicker, to ensure the right diagnosis when you come to us. When you go to a lab where you're connected with, or if you don't know any lab, just come to the Lab to Doctors platform. There's a lot of people on this platform like myself that will take care of you. You may not meet me, but you meet a colleague of mine. There's another interactive question here. Why numbers shift? I would like for you to type a test you know that fluctuates naturally. Type a test you know in the chat window. Which of these tests would fluctuate naturally? Please type it in the chat window. Let's see. If you've been following, I've been talking about some tests changing in the morning, this, that. Let me know if you listen to any of them. There was one I even said that in the morning it's high, and in the evening it's low. Okay, somebody said glucose. That's good. Does anybody have what? Okay, cortisol. That's good. Any other options? Nobody's selecting D or C. Any other options, please? Okay, I'll take these two answers and move on with it. So the analytes that we know that naturally fluctuate. When I say natural, it's natural because your activities, your biological variation will make it happen, make it fluctuate. These analytes are, let's see, I need to put my cursor here. Sorry. So all of this would fluctuate with the exception of albumin. All of this, glucose, cortisol, and testosterone would naturally fluctuate. So if you are going to see a doctor for fertility reasons and they tell you to come and give your sample in the morning at 6 a.m., you better do that. You don't want to give the sample at 10 a.m. when they wanted you to give the sample at 6 a.m. because it's not going to help you to know whether you are impotent or not, whether you are capable of reproducing or not. So it's also good to know, like I said earlier, stick to the time, whatever your clinician tells you. If they don't even tell you anything and you doubt it, look for a medical lab professional to guide you so that you don't have to repeat this twice and spend your money twice. So now, before that sample even gets to the analyzer, during this phase, we call it pre-analytical because on the analyzer, we analyze. Pre-analytical is before we test it. Can somebody tell me the most common pre-analytical error, the most common error that happens before that sample even gets into a lab? Can somebody tell me what that error is? Please drop it in the chat window. A, B, or C? Wrong tube, not fasting, delayed sample transport? Drop it in the chat window, please. Okay, somebody said wrong tube. That's Franklin, okay? Who has a different choice? Franklin says that the most common pre-analytical error is wrong tube. Who knows something else? Who wants to say something different from Franklin? Okay, nobody's putting an answer in the chat. Okay, someone said C, I saw it. Someone said delayed sample transport. Let's see what that answer really is. It is not fasting. You would think I mean, this is really surprising, right? But that is what we notice most of the times, that you tell the patients to fast and they don't fast. There's nothing like I did not fast adequately. You either fasted or you didn't fast. If they tell you that they need a 12-hour fast, they need a not less than 10-hour fast, you need to do it. Don't say, oh, they needed a 10-hour fast and I did a 9-hour fast. And you're hoping that, it's called fasting. It's not called fasting. So fasting is one of the things we've noticed that most people do not follow through, ensure that they do it before they come to the lab. And mind you, fasting doesn't only affect glucose. I know most of us know about glucose, that you need to fast before you go for glucose testing. But I want to tell you that fasting affects your lipid levels, your LDL, your HDL, cholesterol, your triglycerides, your ALT, and your GGT, and a lot other tests. But these are the typical ones that not fasting would affect. Because if you do not fast, your glucose will be elevated. Your LDL that is calculated because of triglyceride will be elevated. As such, your LDL will be elevated. And then it would also cause your ALT. ALT decreases with fasting. So you just need to know what happens, whether you fast or you do not fast, so that when you see your results, you do not fall to the floor and start crying that I'm sick or I'm almost dying, when you actually did not give us the right sample to test you. So we move on to the next slide. Inside the analyzer. So now we are in the lab. That sample has left the doctor's office and now it's in the lab. It's in my hands. It's in the hands of a technician in the lab. There are different reasons why we experience discordance, even within the level of the lab. Method differences. Hemoglobin A1C, which is used in diagnosing or managing diabetes. There's the HPLC method and the immunoassay method. These two methods vary. The HPLC method is actually the method that is affected by turmeric. So can you imagine that if you go to lab A, they use HPLC, you go to lab B and they use immunoassay. Who is taking turmeric, you better be looking for that lab that is using immunoassay. If you know you're taking turmeric, look for the right lab. If you do not know what would affect your sample, again, reach out to a lab expert to guide you. Calibration. Methods are different. So, for example, testing glucose, there are two different methods that we use in testing glucose. There's a hexokinase method that I put up there as HK, and there's the oxidase method, the glucose oxidase method that I presented as OX. Glucose oxidase is very oxygen sensitive. It's also sensitive to your hematocrit levels. Meanwhile, the hexokinase method, that is the gold standard for measuring glucose. Because of the differences, and the hexokinase method is very robust. You can hardly find it affected by an interference, unlike the glucose oxidase method. So because of these differences in methods, it turns out that the calibration will be different. And because the calibrations are different, do not expect to get results from hexokinase and you want to match it apples for apples. It doesn't work that way because the calibrations are different, because the different things that would affect these results are different. So once again, when you go to do your test, if you need help, reach out to an expert in the lab. Otherwise, do your homework before you go out there to give your sample. Interferences. There are different interferences that interfere with the methods in the lab. I just told you about the HPLC and the immunoassay. We have biotin. Biotin is a vitamin that women would typically take to grow their nails, grow their hair, and just other cosmetic reasons. When you are taking things like this, just remember to stop it in advance of going to give your blood draw. Now, how many days in advance is not what I'm going to answer right here. But to be on the safer side, if you are not going to pass out by not taking biotin for 2 days, I would say and you want good results, keep it away. If you are taking multivitamin and you don't know if biotin is there, you need to check it because it's in most multivitamins. So the different supplements you take, high dose vitamin C would also affect the glucose oxidase method. So I just told you about the glucose oxidase method above. If you're taking high dose vitamin C and you're going to a lab that uses the glucose oxidase method, be very careful because you're going to have false results. There are some medications that we take that alter the assays in the lab, that alter the methods. So all of this, you need to be aware. And I'm not saying that patients to become as smart as lab professionals, but I'm saying that we are here to redirect you. We are here to guide you. We are here to prepare you better before you go out to provide your sample for lab testing. Reference ranges. So let's say, for example, you went to one lab. I hope you can see my cursor here. It's under the analyte section. It says lipase. Your results were 70. Lipase is an enzyme. It says 70. In lab A, the reference range is 7 to 60. So according to the reference range in lab A, it means that your lipase is high. But when you go to lab B, the reference range is 14 to 85. Lab B says your lipase is normal. What are you going to do with these differences? Again, try to be consistent with your labs. So your doctor, you can help your doctor to help you. But when you find these situations and your doctor doesn't know how where to figure out where the problem is coming from, then you reach out to a lab medicine expert. The next example is free testosterone. So they measure your testosterone, it says 9 picograms per mil. Lab A actually calculates it and says it's normal. So they don't measure it, they calculate it and they say it's normal. Lab B has an analog. The method they use has an analog, which is an immunoassay. And this immunoassay says it's low. What are you going to do? Without knowing that it's different methods you're dealing with. So again, I'm just here to bring to your attention some of the things that you may not be aware because you are not in a lab setting. So now talking about this is another question for the audience. Interpretation challenges. A, B, C, or D. What are your interpretation challenges? What are the interpretation challenges that you face? Is it interpreting the number, explaining it, both A and B, or it depends on the patient? What are your interpretation challenges? Can you please drop that in the chat window? Please drop your interpretation challenges in the chat window, please. Okay, Franklin, thanks so much for participating. I like this. Franklin says B, explaining it. That's his interpretation challenge. Thank you. Who else can tell me their interpretation challenges when it comes to lab testing? Remember that your doctor is supposed to interpret your results. Sometimes there are patients who just go out and have their test done without a doctor, right? You don't have the money to see a doctor, but you just want to know what's going on with your body because you feel funny. So if you go out there, you have money that is just enough to do the test because lab testing is cheaper than seeing a medical doctor. So, okay, Juwan says B and Leonard says C, both. This is, you guys are all very, very correct. The frustration can range from one area to the other. So right here, the answer for most people, we did a survey for clinicians and other healthcare professionals who do not work in the lab. And most of them indicated that the interpretation challenges stem from interpreting the number and explaining it. So I want you guys to know that these numbers tell their story. Do not try to tell the story for the number. Don't say, oh, it's because I slept late. No, the number has a story and you should stick to the story of the number. If you cannot tell that story, look for somebody like us to be able to tell the right story. Don't give excuses for the number. This is the next one. Type a simple sentence explaining why we are repeating a test. Why do we repeat the test sometimes? Can someone, or everybody, please drop it in the chat window. Why do we repeat the test? Can someone tell me? You go to your doctor and he says, let's do that test again. Why do you think the doctor is asking that they do the test again? Okay. We repeat the test because, okay, Leonard has changed. Said C and A. Did you change to A? Okay. All right. Good, good. Thank you guys so much for participating. Or Leonard says A. So we have A, C. Let's see how many C's. Let's see. So we have okay. So there are two C's, multiple A's, and yeah, there are two C's and multiple A's, and nobody's saying B, right? So let us see what the answer is. Why do you think they would repeat your test, your lab results? Let's see here. That is the reason. C, it helps make the safest decision. We want to be sure. When your doctor wants to be sure and they send you to do it again, please go do it again. I know it's costly. That's why I've told you that you have somebody to reach out to when you need to prepare yourself for a lab test and you don't know what to do. Instead of just doing it on your own and getting the wrong results, and the doctor sends you for a second time when you did not even have the money to pay, reach out to us. Normal doesn't mean nothing. What's confusing about your lab results? Please drop it in the chat window. Is it the ranges that confuse you? Why the numbers change? Is that what is confusing to you? Or C, what is confusing to you? Or why do I feel bad but the labs look fine? What confuses you about your lab results? Please drop it in the chat window. Let me take a look at it right now. Let's see. What confuses you about your chat results? Is it the ranges? Franklin says C. Why do I feel bad but the labs look fine? That's right. I think I would also say the same thing. Anybody else? So we can quickly conclude on this. Let's see. Okay, Leonard says C. That is right. I'm with you guys on that. Let's see what the right answer is. So, why do I feel bad but the labs look fine? That is it. That is the most confusing thing. The next response I need from you guys, type which you track more. Are you tracking your symptoms more, or the labs because they scare you, or both? What are you tracking? What are you monitoring? Is it the symptoms, like, oh, the symptoms did not change? Or you're tracking, oh, the lab results are not changing? Or you're tracking both of them? What are you tracking? Please, can you drop it in the chat window? Okay. So, Leonard, are you saying C and A, or A? I think I want to say you're saying A. And Franklin says C. Okay, Leonard says A. I think it is A because that was the second one. Yes, saying okay, that's good. All right, let's see what and Halima says C. Okay, so let's see what you should be tracking, or what people really should be interested in tracking. You want to track both of them. You want to track your symptoms, and you want to look at the lab numbers. You want to track your lab results. Because again, like I said, do not tell the story for the results. The results have a story. So as you can see here, as medical lab directors, as consultants in pathology, we deal with a lot of words when we go into figure out why your results are not the way it was expected to be. Is it the symptoms, the units of measurement, communication? Was it miscommunicated? Was it lipemic? Is it the timing? Is it your stress hormones? Were you stressed? Is it transportation? It's a lot of things. I cannot read all of these words here. And this is just a few of the so many words that we deal with when we try to figure out what is wrong with your results. So can All of you, tell me one takeaway you have from this webinar today. What have you learned from this webinar? What did you hear anything new? Did anything intrigue you? Are you going to make any changes going forward because of what you heard from this webinar? Can you tell me anything? Anything? Have you heard anything new? If you heard something new, just say yes. If you didn't hear anything new, say no. Let me make it simple. Yes or no. Yes means I heard something new. No means I knew everything you just mentioned. So please start dropping it. Okay, Franklin says yes, I learned something new. Halima says yes. Okay. Everybody, I'm waiting on everybody. I should be having like 11 yeses here or 11 responses here. I had just two. So the others were not listening. I take it. Okay. Juwon, I've not seen your response. Okay. I joined late, so okay, not a problem. It's going to be Richard is going to be on YouTube. We have a YouTube channel, so you can always go there to when the link becomes available, I'm sure they would they'll send it to you. So you've not missed a lot. Okay. So I see most of everybody saying yes, that's very good. So now let's see what's in our next slide. So at this point in time, I want to excuse me. My throat is dry. I want to let you guys know, tell you guys a little bit about Lab to Doctors. Lab to Doctors is a platform that is global. We are set to mitigate and make lab consulting, bring the lab close to everybody, irrespective of where you are in the world. Because of this, we provide these webinars and invite people globally because we are all humans, and so we all use labs, and somebody may benefit from the platform. But I also want you guys to know that every month we have webinars that we present. Next month in April, the title of our webinar would be The Hidden Story Behind Every Test. That is understanding what happens before, during, and beyond the test result. That will be that's the topic for our April webinar. I'm going to ask one of my moderators to drop the link, the registration link in the chat window, so you can go ahead and just register here and be done with it. That way, when it comes to time, you would see my team notifying you that it's time for the webinar. So Mary, please can you drop the link in the chat window for those who are interested in joining our next webinar to register today and not wait for end of April to register? I also want to let you guys know that on the platform, we have continuing education content for non-laboratory healthcare professionals. As long as you use labs to diagnose or treat your patients, it's very important that you know some things about the lab, else you may be misleading, you may be delaying treatment or misdiagnosing your patients. Because of this, Lab to Doctors has created continuing education content for non-laboratory healthcare professionals. We also provide mentoring that we call next generation mentoring. This is for students who are 11 to 20 years of age. They are in the boarding stages of their career. They really don't know what they want to do. It would be nice for someone to hold their hands and introduce them to mentors, to real people who work in the real world, and that they'll be able to at least don't just say, I want to be a doctor. Or through our next generation mentoring, we are going to connect you with somebody who is actually doing that profession that you admire, so that you have a better closure and a better decision as to what you want to do. We also provide prep courses for aspiring lab professionals with a bachelor's degree in any of the sciences. If you have a bachelor's degree in any of the sciences and you want to work in the lab, you can reach out to Lab to Doctors and we'll put you through and prepare you in advance of you even getting a lab interview. That way, when you get that interview, you're not going to look like, oh, I didn't go to medtech school, so I cannot answer the questions like them. No, we are going to make you sound like a medtech by the time you're done with our prep course. So why choose Lab to Doctors? On Lab to Doctors, we are lab-centered and clinician-connected. We work with clinicians just like we work with patients. And we meet multiple different audiences, whether it's a doctor who sees babies or a doctor who sees senior citizens, we reach out to all of them. We also customize our services. If you want to reach out to us, do not hesitate to either use that number, the email address, or go to our website and send a note to us. You'll be able to connect with us. Thank you. And at this time, I'll be taking your questions. Any questions?
Wow. What a session. Thank you so much, Dr. Chessie. So we're just going to take maybe one or two questions. So if you have questions, please drop in the chat box. But I really do think it's safe to say that many of us are walking away from this session looking at lab results a little bit different from how we were looking at it just an hour ago before the session started. And that's exactly the point of this session. So please drop your questions. If you have questions, we can take one or two questions. I know we are at the time mark already, but we can take one or two questions. So please, if you do have questions, please drop them in the chat box. While we're doing that, I would just like to thank everyone today for joining the session. Thank you so much. Thank you for interacting. I saw the interactions in the chat box. I know it was quite an interactive session. Thank you very much for interacting with the session. It's never just a presentation, it's always about, having a conversation, which what made today's session really special and a really rich one at that. So please drop your questions. Let's have the questions in the chat box. Okay, it looks like we do not have any questions. Is it safe to assume we don't have questions? Okay, I think we have one question in the chat. Leonard says, I felt like I had malaria symptoms, but the result was negative and I felt really sick and decided, okay, I'm not sure we got the last part of that. Decided to, is there something else you were trying to say, Leonard? Oh, you decided to take the malaria drugs and felt better. So, Dr. Chesik, you want to speak to that?
Yes, I'm glad that he followed his symptoms and did not follow the lab. You know, your symptoms are valid. And it happens like this when the what we detect in the lab is detected at the face of the disease. So you know about the trophozoites and merozoites and when they come up. So if the lab you went to was looking for trophozoites and you were not at that phase of the disease, then trophozoites did not occur at that time. So they didn't see it. But that didn't disqualify the fact that you were actually sick, that you were genuinely sick. I'm happy you went on, considered that your symptoms were valid, and you treated yourself. Thanks for sharing.
Okay, thank you, Leonard, and thank you, Dr. Chessie, for throwing some light on that. Do we have any other questions? I, I think it's safe to assume we don't have questions, but I think if we do, the start time given for the webinar says it was 12 EST, which is okay. So we usually have daylight savings here. So that's probably why I think the time before used to be 5
6
p.m. But
hours.
now we are like, yeah, 1 hour is it forward or backward? Yeah. So I myself I'm still trying to understand this so time change. But yes,
Yeah.
time change, that's why we have this. Richard, are you joining from Nigeria? I guess you're joining from Nigeria, right? Yeah. So that's why that time. Oh, Ghana. Right. That's why there's that time change. We usually have like, I think in March the time changes and then it changes again in is it November or October? I am not sure. I can't remember. So that's why. So please take note for now. When you have 12 p.m., it's going to be 4 p.m. your time. Right. So that's I think 4 hours difference. So please take note going forward until I think is November again, the time changes. Yeah. Okay, thank you very much, everyone, again for your time. And if today really resonated with you, please share with your colleagues, with anyone that could benefit from this kind of conversations. We'd like to see them in next session. And Dr. Chelsea already spoke a little bit about what we're going to have in April. So please register for that session as well. The link is in the chat. Please register, and we'd like to see you again next month. We have more exciting sessions coming up as well, even beyond April. So please let's look out for that. If you're not following us on social media already, please do that so you'll be up to date with all of the sessions. As I think we also have a newsletter, so please also subscribe to that so you get updates from time to time. Once again, thank you very much, Dr. Chessy, for your time and your expertise today. It was a really amazing session, and thank you all for being here. I hope to see us next time. Bye,
Thank
everyone.
you. Thank you. Thanks for joining us. I'll see you next month. Have a good rest of your day. Bye.
Bye.